Well, good day, and thank you everybody for being here. I hope that everyone's having a nice, wonderful, crisp winter day. So my name is Dewey Case. I'm the Technical Director for the Council of Model Aquatic Health Code, commonly known as CMAHC, and we're very glad to have you here with us today. Today is the first of our webinar series that we're going to plan for 2022. And the topic today is what inspectors wish operators knew. We have an excellent panel of experts that we've put together from across the country that we hope will give everyone great insight into how inspectors think and operate and work and what they're looking for, with the goal of having healthier swimming, healthier pools, and better inspector-operator relationships. The format for today is going to be a panel. So we have a series of prearranged questions that we'll discuss. And then in about 40 minutes or so, we're going to open the floor to questions from you. We do ask that questions be put into chat versus coming on your microphone. So as those come in, we will address those with the panelists. As we go through the questions, do know that each panelist will have an opportunity to respond. Some will, some won't on any given question as it applies to them and as their expertise kicks in. So with that being said, I'd like to introduce our panelists. Our first panelist is Katie Moore with the great state of Texas. She's a public health official there that is very knowledgeable, very experienced, as all our panelists are, and has done a lot of wonderful work. Our second panelist is out of Washington State, and this is June Naotsuka. June is a public health official in Washington and a CMAHC board member. And I have to say this, generally one of the nicest guys out there in my interactions with June. Our third panelist is Mary Shafer, who's a public health official out of Ohio. Mary is relatively new to CMAHC. However, she brings a lot to the table, and we're very glad that she's with us. Our fourth panelist is Bharathi Patimalla-Dipali. So I hope I got that right. She is a public health official out of the great state of Massachusetts. And again, you know, they all bring wonderful amounts of knowledge and experience and expertise into this thing called public health and public swimming. So with that being said, let's go ahead and start off with our first question. So if everyone who is not a panelist can remain on mute, and then June, Mary, Bharathi, and Katie, feel free to come off mute at any time. Okay. Our first question that's open for the panelists deals with pool closings. We all know that the closing of a pool is a big deal for operators and can have major impacts from programming to customer relations, and the list goes on. As a public health official, what do you wish operators knew in regard to pool closures from the standpoint of the health official? So I'll kick this one off to June first, and then everyone else can kick in as they see fit.
Hi, good morning, everyone. This is June from Washington State. As Dewey was wishing for us all, actually, we are having a crisp winter morning right now, and that's very rare here in Washington State. Well, Western Washington State, it's usually gray and rainy and wet, but today it's kind of crisp and blue sky and kind of cold, 25 degrees right now. But anyway, so to answer your question about pool closures and what we wish operators to know, first I would say that operators should know what kind of violations lead to pool closure. Here in Washington State, we see a lot of low-level disinfectant and pH being off, water clarity, meaning the water is too cloudy. You know, you really want to know what violations are serious enough that we have to tell you to close your pool, so you know which violations to correct first. And another thing I would say that we want the operators to know is that when we tell you to close, we don't want you to take it as a punishment, but it's actually, we're trying to prevent imminent health hazard. So we identify a violation and we think it's serious enough, and we think that it might lead to actual illness or injury. That's why we're telling you to close. So when you get that message from an inspector, please don't think it's a punishment, but think we're trying to prevent something horrible from happening. And also the last thing I would say, that not all closures are the same. You know, when we tell you to close something, maybe it's just one pool, or another type of violation may lead to closing all the pools. And some are easy fix and some are tougher to deal with, and it might take time to fix. So, you know, if you have some kind of a staffing shortage or chemical supply shortage, and you know it's going to lead to some kind of violation and pool closure, what you can do is to minimize the impact from whatever you don't have enough of. So yeah, just know what can lead to pool closure and how you should prioritize so you can minimize the damage.
Great, thank you, June. Mary, Bharathi, Katie, anything else to kick in?
So, I mean, I would like to piggyback off of what June has said, is that most of the time our pool closures are due to imbalance in water chemistry. And a lot of the times we do get this question of, can I just, you know, correct it while patrons are still in there? You know, it's just off by a little bit, you know, I can do my corrections. And no, because like, again, June has mentioned, you don't want to expose your patrons to any high levels of chemistry, water, you know, any of the chemicals in there, like shocking your pool and things of that sort. So it is very important to make sure you close the pool, get everybody out, even if it's for a half an hour or whatever it is. And then, you know, you get them back in there once, you know, the numbers are correct. And it, you know, it earns credibility to a lot of the times when we ask you to close down a pool and you, instead of giving me other alternatives, when you do it, you know, there's a respect that suddenly you've now built on. And I now trust that next time a situation like this rises, you're going to do it. And, or if I ask for something, you know where it's coming from, that I get the seriousness of it. And I understand that there's a camp there and you have to tell the camp to get out of the pool. It's a pretty big deal. It's an inconvenience, but this is why, you know, it is at the end of the day to make sure everybody's safe, the patrons are safe, and there's nothing, anything much more to be worried about.
I also agree with that as well. And I will tell you, my worst nightmare was to go into a pool yard and see that I would have to close a pool. It was just because I knew it was going to be, there was going to be a discussion with the owner operator, and it's just our least favorite thing to do. However, there are incidents that you see that you have no choice. Electrical issues are one of them, as well as chemical issues in the pool. And know that the inspector is not happy to do it. It needs more paperwork for us. And, you know, any kind of bureaucracy has lots of paperwork. And it also means that we're going to have to follow up on it, which a lot of times our schedules are so packed tight. So it really is a big deal, not only for the owner operator, but it is for the inspector as well. And it's really one of our least favorite things to do. We don't go into a pool and say, hey, I think I want to close this pool today because I haven't closed one in a couple of days. That's not the way we work. There has to be a good reason for doing it.
This is Mary. I would just totally agree. And that's exactly what my thought was, Katie, to piggyback on you, is that this isn't something that people want to do. They'd much rather work with the operator and not have a pool closure. It's inconvenience for everybody. So, and I think the rest of the panelists gave great responses. Thank you.
All right. Thank you, everybody. For our next question, it's almost a follow-up of this first one, but pool sanitation and disinfection, as we well know, are critical to the healthy operation of an aquatic venue. Can each of you briefly discuss maybe 3 issues that you commonly see at pools in your jurisdictions in relation to pool sanitation and disinfection?
So, I mean, I can go first. I think one of the first things that we notice is that in Massachusetts, our pool code at minimum requires 4 water chemistry tests throughout a day, one of which should be at your peak hours. And many of the times these results are not documented as required, and they're not 4 times a day. They'll say, well, I got the peak hour time, but I didn't do the rest of the time, not when they opened, not when they closed. So that's, you know, that's one of the first things that we notice when we look at the logbook. Another thing, a really big one that we see is that the pool kit that we've asked them to use, that our reg requires, they're not using that appropriate pool kit. And one of the main reasons we're asking for that, you know, we're not trying to make it an inconvenience for you. It's because of the ranges of the water chemistry testing that we're asking for. Not every pool kit can do things within the range that we're asking for. Each state has its own range. And so when we require a certain pool kit, it's because we know that it's capable of doing, you know, measuring between the extremes that I'm asking for. So we find that that's not always true. They're using a different kit from what we've been asked them to use. And also the kit's not kept in good repair, which is very obvious when one of the things we do is that when we ask them to test the water chemistry, we do it with them. When we go to inspect and we test it, we ask they do it with us. So they bring out their kit. And so as soon as they do that and they open it up, you know, I take a quick look, I'm not like prying, but I see it. You can see that the scoop that they're using is really blackened and it's got gunk on it. It's, you know, those little things, they matter when you're testing water chemistry, right? Because it's such minute amounts that we're looking at. So we do see that a lot. And we see a lot of damaged and broken flow meters in the filter rooms. Which makes it really difficult to get, or even if not impossible, to get proper readings and to make sure that your water is being properly filtered or turned over. So those are the main things that we see.
Yeah, one of my big bugaboos in Texas is cyanuric acid, and that's because we have a lot of hot sunny days in Texas. And so pretty much everyone uses cyanuric acid, whether it's in stabilized chlorine or they add it manually. Last year, it was kind of a struggle for everyone, but you'll go in to do a cyanuric acid test and it'll be off the charts. And you'll say, well, let me see your logbook. And you'll notice they do chlorine and pH, but no cyanuric acid readings. And it's like, oh, here we go. Most states, we have certain tests that you were required to do at certain intervals. And in order to do cyanuric acid, it's a little bit subjective with most kits, but it's still really, really critically important, because what good is your chlorine doing if your cyanuric acid is over 100 parts per million? So so that's one of my big bugaboos when I'm going out there, and it's what I train my inspectors also. They have the kits that can easily read cyanuric acid, and it is critically important in Texas because everyone uses it here. Chlorine residuals, of course, are critical as well. If we're going to a pool and it's before they open and their chlorine residuals at 1 part per million, and about 30 minutes from now you're going to have 50 kids in that pool, you know that it's not going to be 1 part per million after those kids get in the pool. So again, understanding the correlation between timing and user levels and where you should actually have your chlorine residual in the beginning of the day or at the end of the day, frankly. So we try to instruct our inspectors, and I try to, when I train them, I try to show them that you need to be sure that you are taking into account user loads as well as the effect of the sun and what's going to happen during the day. It's just one of the things that I teach them. pH, of course, I've had some wonderful experiences with pH, so that's also critically important as well. All of it has to be balanced. And we do require owner operators to balance their water, check their balance of their water at least weekly as a result.
So in Ohio, my program isn't actually going out and doing the compliance inspections. We do construction inspections. And I can tell you, when we're at a final inspection, the biggest problem we see almost I won't say all of them, but I would say at least 75% of them is the perimeter barrier. And they just don't understand the importance of the perimeter barrier and how we look at all of it. We require it to be self-closing, self-latching, and lockable. And it has to meet all three of those criterias. And we run into that problem very frequently when we're out doing that. And I guess it's an opportunity for us for educating pool operators and even the contractors to say, look, this is something we look at. We also look at the gap if they're using a fence to make sure that there is not a gap even with deflection of 4 inches or more. Again, that's another common thing. In Ohio, we have had drownings, unfortunately. And last year, I think it was, we had one where we think they actually were able to get between the gate and the fence. So there was that gap that was enough for them to get through. So that's like a really big thing that we see on the construction side. The other one is having that emergency device available and able to ring directly to emergency services. There are some facilities that like to have it ring to their front desk. They don't like people to be able to dial directly. So that's something that in the event of a pool emergency, time is of the essence, and you don't really want to waste trying to get a hold of someone at one location who then can contact emergency services. So those are things that are big problems that we see when we're doing our final inspections in Ohio.
And Mary, I had a really interesting fence experience. I was out checking a fence and every gap exceeded 4 inches by 1/8 of an inch, 1/4 an inch, just a little bit. And the manager, of course, was arguing with me, what difference does 1/8 of an inch make? And when you think about it logically, well, 1/8 of an inch shouldn't make any difference. And at that very moment, as we were discussing this absolutely, it had to be like a 7-year-old child, very large child, literally went through one of the gaps. It was 4 1/8 inch. He just turned his head sideways and went right through the fence into the pool yard. It was the most amazing thing. It was truly an education experience, both for me and for the manager. But the fencing is truly a critical element, and for any kind of pool enclosure, to make sure that every gap doesn't exceed the 4 inches, because guess what? They can get through really easily. It's terrifying.
Yeah, those are very good points. Yes, Gene.
So here's some statistics from Washington State in terms of violations that lead to closure. About 10% of inspections lead to some kind of closure. And the number one most common reason is low disinfectant. That's about 40% of all closures. And then the second one is high disinfectant, which is about 20% of all closures. And then the third one is low pH, which is about, again, 20% of all closures. So I'm going to just talk about low disinfectant violation because that's the most common one we find. What I find is that there's a pattern. It tends to be the same facilities who get that violation over and over. So I think that we can attribute it to some design issues with the facility or possibly an operator error. It's not happening just randomly at different places. There is some kind of pattern. It's difficult to identify what that pattern is though. But my guess is that something like maybe the operator is not familiar with the disinfectant feeder and they don't know how to adjust it. Or maybe the operator has not been studying the usage pattern of the pool. So maybe they don't know when the pool is busy with lots of people and the disinfectant level goes down. Something like that. So I think it's case by case, but I also know that there's a pattern. The inspectors have that privilege, right? We get to look at many different facilities and find out what kind of patterns exist among those different facilities. But what we don't have is the facility specific knowledge. We're not the operators. So I think it's important that inspectors and operators work together to figure things out.
Yes, wholeheartedly agree. I want to take a moment and just do a quick plug as we talked about disinfection, sanitation. and Katie mentioned cyanuric acid. If you're going to AOAP in about a week or so, we have a MAC track with 9 excellent speakers. One of those is Richard Falk, who's doing a talk on disinfection, and who'll include cyanuric acid in that conversation. So if you're interested in more about CYA and disinfection and you're going to AOAP, please check out the MAC track, specifically Richard Falk, as well as all the rest of our other excellent speakers we have for the MAC track. So on a related topic, going back to our panelists, when we talk about pool water chemistry, getting away from sanitation and disinfection and more just in pool balancing, what are some things that you wish operators knew from your perspective about pool balancing? And let's start off with Bharathi on this one.
As I said, for frequent testing throughout the day, not just once or twice, because that's one of the biggest things that we see is that they're not testing often. And there are also instances where we do see that the logbook has been pre-filled. Like if we flip through the book, sometimes I'll see that the next day or they skip a day and then the next day it's already been filled. And I'm like, well, we haven't had that day yet. Unless you can look into the future, I don't know how you could have told me what the numbers for that day would have been. I mean, it's just how, I don't even know how they do that, such a thing. It's such an easy thing not to do. But so we do have the fact that it's chemical testing, the chemistry testing is very important. If you manage those numbers, you don't have to do a pool closure. Like Katie had said earlier, we don't like to do that. We don't want to do that. And then also the time between your closures to adjust the chemical levels is lessened if you maintain that chemistry. So I'm really gonna stick to that one.
Great, thank you. Let's go on to a new question. So fecal-related illnesses and recreational water illnesses are a major concern for all operators. They seem to be an ongoing problem. What would be your advice to pool operators when it comes to things like Cryptosporidium, Legionella, Pseudomonas, and also Naegleria fowleri, commonly known as the brain-eating amoeba? What are some things as inspectors and public health officials that you wish operators knew? Katie, I'm going to start off with you on this one.
Okay. Well, in 2000, Texas does things in a big way. So when we have things happen, it's in a big way. In 2009, we had a very large crypto outbreak associated with a water park. And it spread to 5 adjoining states or 5 states. It was quite large. And it, as a result, there was legislation passed that required interactive water features, as we call them, to have some kind of method of protecting against Cryptosporidium. And it was really a big deal in Texas because, as you know, we're sort of business friendly and we sort of let people decide on their own what they're going to be doing. But now we had something that was really definite. So we established some regulations for what you had to put on your interactive water features to protect against crypto. And it became, it was a lot of education. Also, there wasn't a lot of product at the time. Basically, there wasn't enough, as one vendor told me, there wasn't enough UV in the United States to supply the state of Texas. It was sort of a gap period. So we had to come up with some other inventive methods, and we did. And they've been very effective. We haven't had crypto, an outbreak of crypto since that time, since 2009, maybe smaller ones. But we have had Naegleria fowleri in 2020 and 2021. 2 children died as a result of Naegleria fowleri. Cryptosporidium, to control Cryptosporidium with chlorine, it takes high levels of chlorine, 20 parts per million, for 12 to 13 hours. With Naegleria fowleri, it's easily taken care of with normal levels of chlorine. So the 2 outbreaks, although completely unrelated to one another in terms of how the children were infected, one was the water supply of the municipality was actually contaminated with Naegleria fowleri, and the other one was just from a splash pad. the results, of course, were the same. So in the case of the municipality having the contamination, the whole municipal water supply was contaminated. They had a boil water notice after the fact, and they found Naegleria fowleri throughout the system, including at the water plant. So that was, the problem at the water park specifically was the water was, it was a single use system. So the water came in, sprayed the people, sprayed the kids, and then was sent to waste. Unfortunately, the design of the water park of the splash pads allowed contamination from soil, and they were heavily encrusted with biofilm. And so, of course, the Naegleria fowleri sequestered in the biofilm. And this was true at the other water park, where the only site of contamination was the water park itself, or the splash pad. And actually, they chlorinated. I'm not sure the levels of chlorine. I got involved after the fact, but they did superchlorinate the splash pad. But the Naegleria fowleri was still found in the splash pad, in the biofilm, and in levels of the in storage tanks, in the storage tank. So, and that's, to me, that was the most terrifying thing, that you could have something as easily controlled with normal levels of chlorine in a spray splash pad. So as a result, the CDC has been looking at taking care of these kind of things, but by maintenance, and they're coming up with plans to help owner operators of spray splash pads treat these systems. And it just, we've had an outbreak of Legionella as well at a retirement community related to a spa, and that is currently under investigation. And those occur from time to time. And then we also, the crypto outbreak, we have not had one of those, yay, knock on wood, in some time. And I do attribute that to the treatment of these spray splash pads that are properly taken care of. And that's the critical thing. Spray splash pads are on a yucca-meter scale, or a little bit below spas, but they're very close. And they, for those of you who are not familiar with their operation, they can really be a hazard, because they tend to become contaminated easily. And if they're not properly treated, you will have the production of biofilm, or you will have sequestering of harmful bacteria or parasites in the system. So maintenance, not only proper operation, but maintenance of these systems is critical. And developing a preventive maintenance plan is critical to the operation of these systems. And that's what we're trying to educate owner operators now in Texas. And I strongly encourage anyone who has any of those under their jurisdiction, carefully examine what's going on at these systems, so you don't have to face the parents of a child who's passed away from brain-eating amoeba. It's not a pleasant experience.
Thank you, Katie. Bharathi, Mary, June, anything to follow up with?
I'll follow up with just something very simple and easy to do, which is signage. Signage all around your facility, noting please don't enter the pool if you have any of communicable diseases, and also signage, and also to let your patrons to remind their kids to make sure they take that cleansing shower before and after. Those are little things, but they add up, and they also create habits, which is a good thing. So I'll stick to signage.
Just one thing from me. It's easy for us to get scared of these, disease-causing germs if we don't know what to do. But if we do know what to do, we know we have things we can do to minimize. So my advice to you is that understand the life cycle of each kind of germs. They all come from somewhere, and they all need something to eat to grow. and they all need someone to infect. And there's a mode of transmission. Study those things and understand how those diseases spread, then we know how to attack them.
Thank you. Thank you all. So next question is, you as an inspector, you're on site at a pool. The pool's clear, the chlorine and pH are fine, they're within range and acceptable. Everything looks superficially okay. What do you commonly see as this pool's top 3 to 5 problems? June, I'll let you start off on this one, please.
Yeah, I have the statistics. So, everything is good, but then we're gonna find first, inadequate barrier. So, fence or gates or doors or windows, they are not keeping small children out effectively. So that's number 1. 2 is cyanuric acid is too high. 3, spa temperature is too high. 4, broken main drains or covers. And then the last one is inadequate supervision. So we see small children using the pool, but we don't see any adults around.
I'm gonna
Ditto.
piggyback up. Oh, go ahead, Katie. Sorry.
I just said ditto, exactly.
I was just going to say, one of the things I saw at a pool that I was not out there on an official capacity at all, but as I was leaving the pool area, I was looking for the safety equipment, the spine board, the throw rope, and it was kind of hidden behind the bushes along the fence area. And so I think, the pool might be fine, but you still have to keep those other things in mind when you're doing your inspections or you're talking to operators, that it's not just the water, there's things around the deck area and everything else is important for them to keep an eye on as well.
Great. Thank you, everyone. Excellent. So let's talk about water safety and drowning prevention for a moment. And this discussion isn't just about lifeguarded pools, but also swim at your own risk pools. So the facilities with lifeguards, let's start there. What's a couple of things that you wish they knew? Bharathi, why don't we start off with you on this one?
I think that one of the first things is that lifeguard, when they're on duty, that's all they're doing. They should not be tasked with anything else. They shouldn't be asked to do pool chemistry testing on the side or anything. We've seen that when we have actually shown up to inspect where the lifeguards were doing something other than what they were supposed to be doing, sitting up there with their eyes on the pool. Because as June has said, there are many times where the patrons are not keeping an eye on the younger kids that are there, whether they be in the pool or on the deck area. So I think that's one of the first things is make sure your lifeguard's doing just that and nothing else. More than that, the emergency communications devices, the ring buoys, all the things that Mary had mentioned, many of times we do see that the backboards, the straps are not good. They are harder to reach. They're not easily accessible. The bolts are a bit rusted. I think that lifeguards should always be able to have access to that and run to it at facility and also at areas that are swim at your own risk that you've mentioned, Dewey. But the lifeguards, they have to just do that, nothing else.
Okay. Excellent. Excellent. Thank you all. So the pool you're inspecting has a really good operator. There's a great relationship there. They're rarely ever, if any, out of compliance. Their paperwork's on point, so no issues there. The sanitation, disinfection, balance, the lifeguards are being ran well. The inspection is nearly flawless. What are 3 things from your perspective that they could take public health to the next level at their facility? And I'll just open this up for general discussion.
I'll start. I was excited for this one. I think if the operator is not already a CPO, that they go ahead and get that. It's not going to hurt. I think the other thing would be is that they would be able to provide swim lessons to the people that are coming to the pool. And I think, you know, if they could at least once or twice during the season have provide a pool safety class for the patrons, so they know that, you know, what are the safety things that patrons can be aware of and control when they're actually at the pool, whether it's, you know, what does drowning look like, you know, how important it is to, you know, just not be in over your head if you're not a good swimmer, and just kind of do that. And that would be certainly, I think, helpful for the public health message. With that's my thought anyway.
I always like to ask them what would they like to have from our side? What would be something of interest that would help them do their jobs better? Communication is a big thing. Sometimes I'll actually they'll give me their contact number or their phone number or their some other way, their email address, and I'll trade that information with them, because I tell them that we're not just there to inspect, that we're also there to help you if you have a question or there's an issue or anything else we can help you with. I have been asked questions about what to do about unruly patrons. And I've talked to lifeguards and to owner operators about unruly patrons or patrons that have been doing vandalism type of things, and they're an HOA. HOAs are where I find this typically. There's been some vandalism. They know they have cameras there, but this patron is a resident there. How do they handle it? So things like that are issues that often come up. But communication is something, and getting communication with the people who are responsible for the pool is what I stress if they have a perfect pool, and even if they don't. And generally, I'm so excited when I walk in and don't see anything wrong with the pool, I can hardly refrain myself from jumping up and down. It's so unusual most of the time, but it's great. It's really great.
I have a question I want to throw to Mary specifically. Mary, in your role as you look at plans and issue permits, when someone's building or renovating a pool, you obviously have to look at those plans and permits and check off on those. What are a few things that you see that you wish the owner operators and that you wish the facility managers you wish they knew when it comes to building or renovating pools?
That they need a permit. That would be my first thing, that they have to actually, you know, submit plans to us. But I think the other thing that would be important for them to understand is that a pool is a system. And so all of the parts of a pool are integral to that whole system working properly. So you want the right piping, you want to make sure the flow is correct, that it's not overwhelming the filter, that the pump isn't too strong or too weak, that we're looking for line of sight when we're reviewing plans, making sure they're not putting the nice big fireplace that they want to have for aesthetics at the apartment pool right next to the pool. We're looking at depth markers. We're looking at all those, because the whole thing is a system, and it's just kind of like your human body, right? We're all a system. And if something's out of whack physically with you, just like if something's out of whack with the pool, it's not going to function properly. But when we're looking at plans, we're looking at it as a system to make sure the whole thing will work fine once we give the approval, construction is started, and we walk away and turn it over to the local health department. So those are things I wish people would understand, and the importance of knowing what the rules and regulations are for that jurisdiction that you're building in. And just because you might be in adjacent, you know, contracting or building in one state doesn't mean if you come into the next state adjacent that you can go by the same rules and regulations. So I think those are really important things. And for an operator, my best recommendation I have when they're undergoing a renovation is to hire a contractor that has experience with public swimming pools and not someone that does residential pools. Not to, you know, crack on residential pool contractors, but it's a totally different ballgame when you're building a residential pool versus a public swimming pool. And it's really important that you get someone that understands that. And so that's a big thing I tell owners for sure.
Absolutely. Thank you so much for that, Mary. So let's look at chemical injuries for a second. It seems like last year may have been 2021, 2020 specifically. It was a little bit unusual year in that we had a little bit higher numbers, at least from media reports, about pool chemical injuries. So what is your big message to operators on preventing pool chemical injuries, either to patrons or to themselves?
I think the biggest issue that we ran into in 20 and 2021 was the shortage of stabilized chlorine. And so our owner operators were scrambling around and stabilizer itself actually, and having to change their chemical usage from stabilized to unstabilized chlorine. And they were doing some things that they didn't really understand were dangerous. And there were some resulting chemical injuries from that. And that's a matter of training and understanding your chemicals. And that's why we encourage people, if they are going to be changing their treatment system, that they hire a professional to come in and manage that, and not just have the lifeguard go from stabilized chlorine to put in unstabilized chlorine in the same tower feeder. It's been a real challenge, and we did have one water park issue, and it turned out that the pressure switch that was designed to detect low flow, a water flow to the system, had been put on the wrong side of the system. And so it was incorrectly installed, and that's what caused the incident. And I know NSF is working now. We had a call yesterday, I believe it was, on the committee, that we're trying to clarify the language in NSF so that if you have an automatic controller, that the automatic controller does have devices on it that will detect low flow, that are properly installed according to the manufacturer's instructions, of course, and that will detect low flow and prevent the chemicals from continuing to be pushed into the piping system when you're not getting water. So those are all really important functions, and making sure that your owner operators of these larger properties are, if they have an automatic feeder, that they get them checked from time to time, that they have them. We have a maintenance contract is very critically important. It's training in a lot of sense, because people don't understand what can happen if you're mixing your chemicals incorrectly.
Something else I'd just like to add, something very simple, is use the appropriate PPE. Make sure you have it, make sure it's in proper condition. It's such a simple, easy thing to do. Make sure it's in accordance with the SDS of the chemicals that you're using, like Katie had said. Make sure you know what that is. That goes a long way in preventing these injuries.
Yeah, this is a complex topic, but I'm going to oversimplify and say that there are two types of serious chemical incidents that happen. One is a type that if you mix the wrong kind of chemicals together, it releases chlorine gas. And the other kind is mixing oxidizer with something that gets oxidized, which releases heat, which leads to fire or explosion. So basically those are the two types. So I don't have time to, go through all different kinds of chemicals and what happened if you mix the wrong ones. So please ask your inspector. But yeah, please know that those are the two types.
And I want to add, check your interlocks. It's not enough just to have the interlocks. Make sure they work. Checking them monthly is what should be happening to make sure that it'll prevent unwanted chemical exposures. So, okay, cool. Thank you.
Yeah.
So next two questions kind of shift from operations and more into inspector-operator relationships, right? This question is for each of our panelists. If you could look at each attendee face to face and have a conversation with each attendee, what is the one critical question you would ask them about how they manage and run their pool?
I'm gonna go first. Katie mentioned this already, but I think, my question to you would be, why did you decide to work in this industry? And what can we public health officials do to help you achieve your goal?
I would probably ask them, what can I do to help you understand what needs to be done? What training courses do you need? What information do you need? How can we make this easier for you to do your job?
Yeah, I would ask them to have specific questions, like when we come to the inspections and as we get talking and walking through room to room, suddenly they'll say, the other day this happened, and then we can give them a direct answer to how to fix that. And that leads to other tangential things. And so specific questions, even if it's something that, you think is simple or you could look it up, doesn't matter. Ask me. I'm there in person for a reason. Ask me that question, because that leads to so many other tangential things. So specific problems is always good to have instead of a broad something, because like they've said, we're here to help you. And it's a conversation.
I think for me, if I were asking an operator a question, it would be, what do you want to have accomplished with your pool? And what are your top 3 concerns that you have with operating pool? And how can we help educate you on that and get you to reach your goal as a pool operator? And understanding that a well-run pool, if it's guarded, can save lives every single day. And that you can be a lifesaver if you run your pool well and you have your guards. And just reinforce the fact that we have accidents in pools. We have deaths in pools, as well as we have long-term health problems. And so you want to run your pool the best you can, because you want to prevent that from your pool and you want to be a lifesaver. So that's kind of what I think I would ask.
Great. Thank you all. Before we get to our last question, just as a reminder, if you have a question, please enter those into chat, and then we will address those as we can for the remainder of our time today. So our last question, there seems to be a certain level of trepidation when an inspector arrives on the pool deck. What's the big thing that you'd like the owner-operator to remember? And also, on a related note, what are a few recommendations you have for operators to have the best relationship possible with their inspector?
I think we kind of hit on that already. It's, communication, talk to them. Don't be afraid to ask a question. I'm not inspecting anymore, I'm managing, but when I was an inspector, if an operator called me and said, hey, I have this situation going on, what do you think is the best way for me to resolve it? Or, just to be upfront with them and understand that it's a relationship. It's not one where we're coming in and we're trying to ding you and just, cite you and all that kind of stuff. We really want the best relationship possible, because in the end, that's best for public health and that's best for the people that we're working for.
My biggest thing is don't hold back. If you're having an issue that day, tell me something's wrong, whatever the issue is. It's better for me to know it in advance than to find it out by other means. Just come clean and let's work on getting this fixed. 9 times out of 10, we're not going to close your pool because there's a minor issue. If it is a large issue, then yes, we might have to discuss closing the pool. But your inspector would much rather you tell us what's going on and not going on, and what problems you're having in advance, rather than our having to discover it. And believe me, we will discover it. We you know, most inspectors, that's what we do. So just be open in your communication and realize we're not there to ding you. We're not there to write you up. We really, that's, you know, I used to go to court, and it was time consuming and unpleasant, and the results will never satisfactory for anyone. And so we would prefer to avoid any kind of further action other than just trying to help you get whatever is wrong taken care of. Just come clean.
I would say that please know that inspectors are also people, just like operators are people. You know, we both feel nervous about each other, right? You think inspectors are mean. Well, some inspectors think that some operators are mean, you know. So I think communication is important. And, you know, if conversation becomes uncomfortable, just stay focused on health and safety. That's our common goal. By staying focused on that, I think we can stay on the right track.
Absolutely. I agree with every single one of them. Conversation, communication. I mean, if I come to a facility and nothing's wrong, that actually worries me more than anything else, because that's not possible. A pool is a dynamic environment. It's constantly, people are coming in, coming out. There's no such thing as perfect. And don't think that you have to be there. It's okay to have an issue or a concern, or you have to repeat your water chemistry. It's okay. I'm glad to see when you do that you're correcting it. You know, a pool is a living, breathing thing. So don't worry that if there's something wrong, we're not immediately going to close you down. It's probably some easy fixes, something to do. So have a conversation. Don't hesitate to call us. Just everything that the other three have said.
Great, thank you all. We had 2 questions come in from chat. And again, it's not too late to get your question in if you have one. The first one comes from George. What training is available to public health officials to take their knowledge and skill set to the next level?
So, I mean, I don't know, there's a lot of national training available, like CPO, Mary had mentioned earlier. If you don't require that, that's a really good thing to have one individual to be a CPO on your site. But in Massachusetts, we also, to all the state-owned facilities, they're owned by our Department of Recreation, we actually provide a yearly training to them. And we ask that all their lifeguards and their pool managers, assistant managers, whoever it is, come and attend that. It's a free one that we give so that they can ask all their questions before the season begins. We do this before the pool season begins. And it's to keep that conversation going, that line of communication open with this entity. So I mean, there's a lot of national ones like CPO, but I think that if there's any training that we inspectors directly can provide, it's easiest and best because we know our regs, we know what we're looking for, and we know your pools because we are the ones coming to your pools.
Great, thank you for that. One other question comes from Jen, and I'll say the whole thing and then we can parse it out. Are pool inspections typically announced or unannounced? If they are all announced, should there be consideration to having more that are not? And do your codes speak to requirements of having announced versus unannounced inspections?
Well, I responded in writing. The state of Texas inspections are generally unannounced. Now, if it's a construction inspection, and the state of Texas doesn't do construction inspections, but local entities do, they do have to make them, they have to announce them because they have to meet the contractor on site. So typically those are scheduled and announced. The only ones that would be announced inspections would be if it's a specific incident that occurred at a facility, and it would involve several different entities meeting at that site. But in general, Texas inspections are unannounced.
in Ohio, inspections are unannounced as well. On the compliance side, construction inspections are run through the state, and we do have to work with the contractor for scheduling those. I would just want to piggyback on that previous question for inspectors and training. I would recommend if they can go to like the World Aquatic Health Conference, you know, any type of national conference, you know, that would help on the inspector side of training. I have had staff go to those conferences and they come back and it's a great experience for them. So if you can, on your inspector side, find training where you can do that, go to those national conferences. I know it's kind of hard sometimes to travel, and especially if it's out of state, there's a lot of maybe restrictions on that. In Ohio, we try to put out, thanks, Dewey. We try to put out training routinely on different topics for the local health department staff so that they can refer back to it and, you know, have that training. But that's just one of the things I would recommend if they can do that.
One of the best trainings you can get, honestly, and this is what I did, sort of, it didn't start off as something that I wanted to do. It just was something that happened. If you can get on some of the committees with the Model Aquatic Health Code, even NSF, and pick those topics you know the least about, that is an incredible way to really get an in-depth training in the ins and outs, not only of standard making, which is critically important these days, but also in topics that you may have a weak point in. I know in Texas, we had a problem with certification or NSF certification for crypto inactivation at interactive water features. All of these interactive water features had UV systems that were not standardized by NSF or didn't meet NSF 50 for crypto inactivation. They were for other, they were standardized for other things, but not for crypto inactivation. And the regulations require crypto inactivation for interactive water feature UV systems. And the inspectors didn't know. The inspectors just saw an NSF sticker and they were like, it's NSF certified, here we go. So getting into the weeds about some of these things is really, really important. And anytime you can join up with these organizations and get on our technical review committee or just on a committee to a working committee, it's great education. And I really encourage inspectors to do that.
Absolutely. And I replied, a comment in chat for inspectors, health officials. NEHA has a free offering that was developed with CDC. So that's one we can point to. And then we see lots of stuff from Watershape University. We see lots of stuff from the Pool and Hot Tub Alliance that are really great trainings. And also pay attention to what we're going to do with CMAHC. Part of what we're doing with this webinar series is targeting education to where not only operators, but also health officials can gain more knowledge and be more knowledgeable about the ins and outs of what's going on. So definitely pay attention to us, in the coming months and years as we seek to educate everyone involved on all things with the MAC, obviously, and also with pool operations and inspections, and from the public health side of things. So we're coming up towards the end of the webinar. I want to give a huge thank you to our panelists, to Katie, to Bharathi, to Mary, and to June for taking their time out today and lending their expertise and their experiences. I want to give a big thank you to our CMAHC team, Christy, Susan, and Jill, for supporting and doing the behind-the-scenes work to make this happen. And I want to give a special thank you to you as an attendee for taking time out to come today and to listen to these great minds talk. We hope that it has been educational, and we hope that you've been enjoying it. And we hope you've had a good time, so to speak, with this webinar. Please pay attention to future webinars. We're looking to do a webinar roughly every quarter on various topics. we're working on developing what we hope to be the April webinar now. So please pay attention to cmac.org, follow us on Facebook, and just look for new opportunities as we come out and as we develop our webinar series for this year. And again, if you're going to AOAP in a week or so, please come by and step into our MAC tracks and those offerings and learn more about the nuts and bolts of things. We also, there's a public health track there for inspectors. And also, we're going to have a booth. So please, if you're there, swing by, shake our hands, say hello, and meet us. And we'd love to meet you as well. And as always, the big plug, if you are not a CMAC member, we do encourage you to join CMAC. Our motto is driven by your expertise. So in joining CMAC, not only do you have opportunities for webinars and other educational things that will come down the pike, but also you can participate on committees and make your voice known in the updates to the Model Aquatic Health Code, as well as updating the Model Aquatic Health Code from service on committees. So it's a 3-year membership for $120. That's $40 a year, which is extremely cheap. So if you're not a member, we encourage you to join and be able to participate and get the full range of what CMAC has to offer. With that being said, I want to thank everyone for coming today, and we look forward to seeing you in future webinars and in person, whenever that may be. Thank you, everybody. And thank you to our panelists.